back on June 3rd, and it is the Board of Health meeting. And this is a meeting being held virtually through Zoom. The town of Littleton began conducting remote participation / Zoom meetings pursuant to Governor Baker's emergency order suspending certain provisions of the open meeting law on March 19, 2020. Since that time, unanticipated legal concerns relating to the open meeting law have been brought to our attention by the town clerk. Those concerns were supported by the Attorney General's office and confirmed by town council. One concern is that the chat function allows a parallel text conversation to a board's public meeting. Chat is essentially running commentary that is occurring, but it is not moderated or followed by the chair. All participants and listeners may not be aware of comments being made because some meeting participants join by phone and do not see these conversations. Another concern is conversations between residents within the chat room, which are not incorporated into the public record. In response to these concerns, the town will implement the following changes, which in no way prohibit any member of the public from participating in discussion and sharing information during a public meeting, and will ensure that all listeners and participants have equal access to this meeting. People that join the Zoom meeting are set so their microphones are muted. If you are called in by phone, please use the *6 to mute or unmute your phone so that the meeting can occur in an orderly fashion. We ask that people who join keep their microphones on mute so background noises do not interfere with the meeting. If you wish to participate in the meeting, please use the raise your hand function available on Zoom, or if you called in by phone, dial *9, which will activate the raise your hand function. The meeting host will notify the chairperson of the raised hands, and the chairperson will determine whether and when to allow public comment. When called upon, participants should unmute, then state their name and address. After speaking, we request the participant return their microphone back to mute. And before we get started, I want to just make a reminder announcement about the meeting for the water department this Saturday, June 6th. It's at 10 a.m. and the Littleton Water Department will hold a Zoom webinar regarding PFAS. It can be watched on LCTV, or people can join the Zoom meeting with information found on the Water Department website. So that's June 6th, this Saturday at 10 a.m. Okay, so everybody should check that out, see what's happening with the PFAS in town. The next thing is, Scott, would you like to give us an update, please?
Good afternoon. So everything COVID related in town, medical-wise and ambulance response-wise, they're kind of status quo, which is a good thing. We've been working with Town Hall to try to prepare for an opening. Plexiglass panels have come in at Town Hall. Those are being placed now, and we're currently going through everything, making sure there's going to be an appropriate amount of PPE in Town Hall, hand sanitizer, masks, things like that. Is what, in addition to some of the other departments as well, highway, transfer station, light and water. So everybody is, for the most part, compliant for that. Everybody's going through the self-certification process right now to make sure that each facility meets the requirements set by the governor. So we're still probably, I'm guessing, a couple weeks out before Town Hall is back up and operating. Granted, some of the managers are in right now, or at least taking their turns at occupying space. Between working from home and there. But for the most part, things are good. We are in the process now of replenishing our stocks for PPE. Going forward. Hopefully we're not getting ready for a second wave or anything like that with the protests that are going on. Let's try to stay positive with that. But other than that, we're in pretty good shape.
Great. Does anyone have any questions for Scott?
I'm sorry, this is Mike. I'm not trying to litigate anything with you or anyone else, Scott. It's more of the thinking that goes into this. But what are the folks using to tell them that the measures taken, whether it's for the town offices or anything else that you're brought in to sort of help set up, what informs you that it's working or not working? Let's put it that way. How do you? I mean, what's your thinking about that?
I'm sorry, Mike. I'm not sure what you're asking.
Okay. All right. What I'm asking is that under ordinary circumstances, I'll use a simple example, very simple one. Every once in a while, someone shows up I'm using something that's neutral. Someone shows up at the beach, takes a sample of the water, brings it back to the lab. Oh, too much bacteria, too many, little protozoans sticking around. Close the beach, close the water, okay? Or everything is fine. You can go back in the water. I mean, it's the example doesn't make any difference. The point is that there's a reason why, during warm days, the water is either available or not available, okay? So by analogy, what I'm asking you is, here we have water. Instead of water, it's the town hall or whatever, even your facility, okay? I mean, if I would have nightmares trying to figure out how to keep that place clean, okay? Not because you guys are dirty, there's so many surfaces, so many different places that people touch. I mean, it's just, all right? So what I'm asking is, just your thought, maybe it's a nightmare, like it is for a lot of us. What goes through your mind when you say, gee, I've gone through this whole elaborate thing with Jim and everyone else in town to make people safe. How do you know it's working, and what tells you it's not? And if you say you don't know, I understand perfectly.
Well, I would say we go through the same procedures every day, at least for the fire station and the police station. We decon our facilities on a daily basis. We decon our ambulance after every medical. It gets sprayed with the antivirus spray. Knock on wood, everybody within our facility has and continue to do so. That alone would lead me to believe that we're doing the right thing, especially for the amount of COVID-related transports that we've had. Going forward, we're trying to follow the guidelines set forth by the governor and the CDC, and putting everything in place in town hall that they're recommending to, keep the social distancing, to keep, protect the employees for that time when the public comes back in, to keep that separation. By putting up the plexiglass windows. George is going through town hall. He's wiping things down with bleach on a daily basis. We've been there a couple times as well to spray the virus, the electrostatic virus spray through town hall. That's one of the things I think that'll be coming forward on as a regular, as a daily occurrence. Once employees come back, we're waiting for a few more of those sprayers to come in as well, so that we could have them for, the one that we have right now, we're borrowing from the schools. So the schools have been generous enough to let us keep it since school's out of session. That'll be going back to the schools once ours come in, and I'm sure there'll be a few more purchased that'll be in town. Knock on wood, we're doing everything that we can, and we haven't seen other employees getting sick or anything like that. So, and the numbers in the town, I would say, are starting to come down, in addition to the whole state. But I would say everything that we're doing right now is pretty much the best that we can do. And we haven't seen any of our numbers go up.
You nailed it. I mean, the fact that you can cite the fact that you've got lots of staff that are, shall we say, doing just fine after the measures you've taken. I think that's probably the best correlation I've heard in weeks. So, fantastic. Good.
Thank you.
Scott, I'm going to ask you, but I'm going to also talk about it with Jim when he gets here. I don't know what we can do, but there's new. They're going to start letting people visit for long-term care facilities. So outside visits. Is there anything that you think that you need to add or change, or not that that's under our purview, but I mean, kind of.
I would, I think as we look forward and pay attention to everything else that's going on, some of these measures that are taking outdoors, it's the right way to go. In an open atmosphere, I think there's a less chance of transmission. The fresh air, social distancing, people continuing to wear their masks. We're doing the best we can. We're seeing the numbers come down. That's a good thing. Whether it's starting to die off or all the precautions that we're taking are the right thing. Continue to do that, and hopefully we'll hit a point where the numbers continue to go down and go away. But the outside, it's the right thing. And continue with social distancing. I mean, we're not going to still remain with the small groups, at least until it starts to change and the numbers improve.
Okay, thank you. Kevin, do you have anything for Scott?
No, I don't.
Okay. Let's go to Jim Gareffi. Can you give us an update?
Sure. So again, busy times. Information came out about camp guidelines for opening. The camps haven't opened yet, but the guidelines are out so that camps can take a look at them. And I think everybody's waiting for what the decisions will be made on Monday. Whether camps will open or not. The beaches are open. Pools, the sports guidelines for youth sports came out a half an hour ago. So just taking a look at those and trying to absorb that information also. With the exception of one complaint that both Louise and I have addressed, I'm not sure we have had many complaints about mask wearing in town. The places that I've been to, people seem to be generally complying with the order. So I'm not sure I have much more. As Scott mentioned, the numbers are coming down. It's very nice to see the trend lines going down. And just kind of as an agency, we're seeing the total number of cases being referred to us for contact tracing and going down too, which is nice.
Good news. That's good to hear. So I don't know if you heard, Jim, that I had asked Scott about the new opening for outdoor visitations at long-term care facilities. And then I know that's not something we really control, but what do you think about that?
I haven't had a chance to review the policy, so I'm sure, just given, the kind of the sensitivity with the number of people passing and families wanting to see people, if they can find a public health way to allow that to happen. I think that's probably good for the families and for the patrons of those facilities.
Well, Life Care facility has a lot of room there to spread out outside.
That's right. And I think they even have that kind of, I want to say, gardeny area, livestock area up on as you come in. So I think that's meant for the residents of the facility to lift their spirits, something to, I don't know. Yeah. I mean, it's kind of a neat little area. So
yeah.
And as the weather's getting better, hopefully they can get residents outside just in general.
I'm sure, it'll be huge for them to see their family.
Oh, absolutely.
Okay, so I did see the camp's information. It was forwarded to me by Park and Rec, but I didn't forward it because it wasn't officially from the Public Health, DPH. So did you get it from DPH?
That's a good question. I haven't even looked at it yet, to be very honest. So it came in part of an email as part of a whole bunch of updates. So.
Well, should I wait to get it from you, or can I forward what I got?
I would go ahead and forward with that. I mean, I assume it's the working stuff. That's on Monday. I assume the stuff that they sent out is to allow camps an opportunity to see what's going to be required of them. And whatever announcements are made on Monday will kind of solidify what's going to happen.
Was that the camp checklist and the minimum health and safety requirements?
As they're doing with all of the openings, yeah.
Yeah, that came direct from DPH.
Oh, so Tim must have sent it to you, Louise?
He did.
Okay. I think he was at a meeting. We got the information from DPH sometime later in the afternoon. He was at a meeting where they received it just a little bit earlier, as been the case with these notices. So,
yeah, it looks like his is from the Department of Early Education and Care.
They're kind of working together for that release because it's because camps are considered in that continuum of childcare. I think the two are working together on that.
Okay, so I will forward this to the members. I'll forward it to Janet. Janet can forward it to the members.
Sure.
Okay. Anything else, Jim?
No, I think that's it.
So it sounds like we've had a good past week at the lake. Better than when it was not open and it was transitory. It was more controlled at being when it was open. So hopefully it will stay that way. We'll keep an eye on it. Anybody have anything for Scott or Jim?
Not I.
Okay. Janet, is there anyone in attendance that has a question or comment?
No hands are raised.
Okay. So I wanted to talk about if we wanted to change the meeting format for this Wednesday meeting. I've gotten back to full-time work, and I know Lisa will be shortly, so I was wondering if we could make it every other week. We would still meet every week, like one week it would be a Tuesday, one week it would be a Wednesday. So, but the Wednesdays would be every other. Is that agreeable to everybody, or?
This is Kevin. That's fine with me.
Okay.
Well, which of the two meetings are you talking about, Louise?
The Wednesday meeting.
Oh, the regular. Yeah. Okay.
We have to still have the regular Tuesday night meetings.
Yes. Okay.
But these Wednesday meetings, I was wondering if we could just do it every other week, since it seems to be slowing down, and we're kind of accomplishing some tasks with the lake, and then we'll go through the Camp T issues. So I feel like we're okay to go every other week. Is anybody?
I'm back. I'm here. Can you guys hear me?
Yes, Lisa. Thank you.
I'll be working on Wednesdays, so I could do it at lunch, but lunch would be 1 to 2.
Is that okay?
Well, I don't know. Monday afternoons and Fridays would probably be better for me, but I actually don't know what my schedule is going to be like. So we can try doing every other Wednesday from 1 to 2 if you want. And then if something changes, then I'll let you know.
Okay. Can everybody else do that?
I think the scheduling was because of Jim and Scott, I think.
Yeah, I can do Wednesdays at 1.
Wednesday would be better than Friday.
Okay. Mike, you're good for Wednesdays at 1?
Yeah, I can shift things around. Yep. I can also run 2 Zoom sessions at once, so it's okay.
Oh.
Yeah.
Okay, so
why?
So since we're having one today, I would recommend that we skip next week, and then our next Wednesday would be the 17th, because we have a meeting Tuesday the 9th, and then so our next Wednesday would be the 17th at 1 o'clock. Janet, do we have to take a vote on that? Or
Janet had to step away.
Okay. That's okay.
I don't believe you have to take a vote on it, but I don't know.
No, I mean, it's your meeting schedule. So if you want, I mean, this is certainly public notice. that, based on the conditions that you're moving your meetings to every other. It'd probably be good maybe if Janet could put up a notice, since people are used to, if they're going to participate, they're used to the Wednesday at 2:00 every week, and it'd be nice for them to know every other Wednesday now at 1:00.
Yeah. So I'm sorry, I'll put it up on the website as well as on the meeting.
Okay, thank you, Janet. So our next meeting is Tuesday night, a regular Board of Health meeting, June 9th, and then a COVID meeting, the 17th at 1:00. Is that okay? Before we leave, I have a couple of, does anybody have any other issues for Scott? Because my issues are not for Scott. We could let him be free.
All right.
I think someone should write a manual on how to take care of the real world when everything is falling apart. He and Jim should co-author it.
Good luck with that one.
Yeah, exactly.
Yeah, where are you going to find the time? Yeah, take it
Bye,
easy.
Scott. Okay.
Louise, maybe this isn't the appropriate time, but when we get back to after the election, do we want to talk about changing the time? Is it too soon? Changing the day and time of our meetings?
You mean the Tuesday nights one?
Yeah, to accommodate everybody.
Sure, we can talk about that.
Whatever, I work until 7 on Tuesdays, so I have to leave early, and maybe we should wait and make sure I get elected.
Who just said that?
Lisa, maybe it's inappropriate to talk about it at this time. But
you might jinx yourself.
No,
it might be a write-in.
And bad luck too.
We'll talk
Kevin.
about it. Let's talk about it on a Tuesday meeting. Never mind.
Okay.
No, I wasn't. I wish we would just settle it. I mean, she's not politicking. She's just asking for accommodation.
We don't want to jinx her.
She can't be jinxed.
There might be a write-in. You never know, Mike.
Please. Shh.
Okay, so Jim, can you explain to everybody about the email you just sent?
Yeah.
I asked Janet to forward it. I'm not sure if everybody was able to see it.
Sure. So that's
because it needs a quick turnaround, so we need to talk about it.
Sure. So in responding to all this pandemic situation, we the agency, Neshoba, brought on at any given time 2.5 to 3 nurses to help us with contact tracing. And we were able to do that because the Department of Public Health provided some emergency monies for us to be able to do that. That money, those contracts end. They're supposed to end at the end of June, but they told us we could apply for an emergency extension to use the money to the end of August. So our concern was what's going to happen after August. I don't think the pandemic's going to stop, and we may still need to have some level of response. So in trying to think ahead, what I've said, the email that Louise was circulating around was my request to the board to ask your town to allocate or set aside monies that they received through the CARES Act to be able to handle contact tracing and pandemic services through the end of next fiscal year, which would be June 2021. So that's and essentially what we asked for. Neshoba sends the town an assessment for environmental services. That's essentially what you think of the Board of Health work that I do, and a nursing assessment, which is what Tamara and our other nurse, and then other nurses that have been helping us do. And so we asked that there be an additional nursing assessment for this upcoming year to be able to help us with that pandemic work that we may need to continue doing. And the deadline, unfortunately, for towns, I wish I understood the CARES Act process a little better. I've talked to a couple of town administrators about it, but there seems to be a deadline of Friday to submit requests to use the allocation. So that's why the timeliness of it. So
there's no number put to it. Yeah.
Yeah,
So-
there's a number. Yeah, there's a number on the letter.
There's a number in it's your nursing assessment's probably down 3 or 4 paragraphs. It talks about the budgeting.
Oh, I see it.
Yeah, so it's in the actual attachment. So I think your assessment's probably $10,000 to $11,000 or something like that, if I had to guess. And I guess what we're asking is if you could ask for that money again, that essentially 2 of those for this coming year. One we've already budgeted during a normal process, and another one allocated against that CARES money. What we're looking at, we have money through the end of August. We thought that if we could kind of allocate maybe 30% of that total, that newer total, to the end of December, that would probably get us through the end of the year. Again, we can't really know what's going to happen. I mean, I'd like to think this all dies out and we don't need any extra money because we don't have to do it anymore. But I think that may be wishful thinking. And then see how the time from August to December goes, and then kind of reassess what we might need going into, essentially January to June of 21.
Okay.
I don't know if that makes sense or not, or.
Yeah, absolutely does. So do I have to bring this to the Board of Selectmen, or?
Yes.
If you could forward it to Nina, I guess, as the chief municipal officer. I'm not sure who in Littleton's putting together the request to go into for the CARES Act, but I assume she needs to submit it for June 5th.
Okay.
Madam Chairman, may I suggest that anything you send to the administrator, you also send simultaneously to the chair of the select board or the BOS? That would be Cindy.
Yes.
And make sure it's highlighted. I mean, both should be on the same line.
Yes.
And if either one of them has any questions, I'm more than happy to kind of discuss what that's all about.
Okay. Thank you.
Jim, really quickly, just wondering, can we utilize funds from the CARES Act to potentially provide testing equipment?
That's a good question. I'd have to go back and look. I'll send you the CARES Act information I got from the state, and then maybe we can have a conversation about that. It's really broad categories. It's kind of any kind of stuff that you need for COVID-related response actions. So I'm not sure if they'd look at the testing as that, but I don't really know the answer, Kevin.
Okay. Yeah, just from my research, if it just seems cost prohibitive for different businesses to test their employees, and at $305 a pop for Fallon to do it, and then they do all the legwork, or it's if we can make a deal with Quest Diagnostics, they can do it for $70 a pop, but we have to do all the legwork and log all the data and put it in the system, and then contact tracing and all that stuff.
So with Quest, who does the swabbing? Who does the actual sample taking?
It would be our staff.
Okay. Yeah, because that was my understanding. If you go up to Quest's website early on when they announced they were doing the testing, they essentially said, "Don't come to our locations because we don't do the swabbing." So I wasn't sure if they had opened that up or not.
I don't believe so. No, it would be all on us, but we could get the test kits for $70 each.
Yeah.
I guess we just have to weigh the benefits of having someone else do the legwork, or if we have all that extra time and energy to do it ourselves. I don't know.
So is that something Alex McCurdy and his group would undertake?
Well, I think you need to have a medical provider right in order still. You need to have Fallon Ambulance Services, one of the services that seem to do the swabbing. You do need to set up a location, I would assume. I don't know if you were thinking of trying to do it at mobile to business, or just a clinic for the town, or.
I think it should be, widely available. So, employees that are coming from out of town into businesses, as well as, residents, just so we can.
Kevin?
Just so we can try. Yes. Can you hear me now?
Yeah.
Hi. I was thinking it would be for businesses, for employees coming in from out of town, and different employees in town, as well as widespreadly available for the residents too. I think the testing is the key to try and get back to somewhat normalcy here.
Right.
So I guess you want me to read through that CARES Act and see if I can pull anything out of there that might be beneficial.
like I said, I just haven't read it that detailed to know. I know it's for related expenses for communities, whether it would include doing testing of community members. That's the part that wasn't clear to me reading it.
Okay.
But like I said, I'll send you the document that I was working with and you can take a peek.
Okay, sure.
Kevin, did you get the email from, that I forwarded to you from Alicia?
I did. I got it this morning, and I picked out a bunch of different times that'll work. So hopefully they can settle on one, and we can schedule that meeting.
You're in contact with her?
Yes. Well, I just signed up for her calendar. That's all. But.
Oh, okay. Yeah. All right. Anything else? I have one more item for you, Jim, that Mike made me. Well, I was aware of it, but Mike reminded me. The Pondside Apartments septic system. Their BOD limits have failed permit requirements. The comment was the sand filters were clogged, causing a buildup of biosolids within the system.
Okay. So I haven't seen the report, so I can chase down the report. Pondside has a wastewater treatment facility. Those facilities are governed by the state. So I can follow up with the gentleman at the state who handles the wastewater treatment facilities and see if there's some action that's being taken to have them address that.
Well, someone did reply to it. Do you know who that was, Mike?
Was it Dave Boyer or?
Not sure. Hold on, let me. Sorry. Of course, I can't find it now.
Can you forward the email to me, and I can take a look at it?
Yes.
The Pondside system, is my understanding, Jim, has been having problems for quite a while.
Okay.
This is not the first report. I'm not putting it on you.
No, it's.
And I just didn't know. And the only reason I got a flag is because my system reads my emails for me and picks up keywords and said anyway. So when they picked up the the frequency with which this issue has arisen, I sort of wondered who lands on the doorstep of the people who run that facility and own it or whatever, because it's a mixed community and there are lots of other issues over there, and this seems to be one of them. I just didn't know how it got handled, because that could be, I have no idea, it could be a dangerous or not situation, but it definitely is concerning. So if I don't know if the state at the moment has the time or the resources to pay attention, but this one seems to be repeated over and over again.
So I can certainly take a look into it, Mike, and I can contact David Boyer. He would be the gentleman at the state who handles these wastewater treatment facilities, and I can find out what's happening on his end.
Good. So I just found the email, and so it's Small Water System Services doing the reporting, and Daniel Camplin,
he's
emailed Kim Packard and John Mohammed, Deborah Trumbull, Tom Staniak. But he's talking to John. Can we set up a call next week to discuss these results? This should have been back within limits by now. It's been out of permit since November.
Did you send that to me, Louise?
Sure.
Okay, great. So, I guess there's two components to that. Because they're a large system, the state says you need to put treatment on it. The treatment needs to meet these certain standards. I don't know that it would be considered, again, I'm not sure how far outside the range the BOD is. It's not an imminent danger, but it's one of those things where typically when they get out of range, they're supposed to make corrective action so it gets back into range. And so based on the comments you just said, sounds like they haven't gotten there yet. So
right. So since time has passed, I think we need to check in on it.
Sure.
Okay, so we just have, does anybody have any comments or questions for Jim?
I just had one other thing. So I'm sure Parks and Recs are going to be looking for an answer on Camp T.
Mm-hmm.
So with the camp guy, I see Mike laughing. I'm going to take a look at the guidelines. I have a call from John Kazanjian from Parks and Rec about trying to set up a meeting with me to sit down and go over the guidelines. So is this going to be something that you'll be talking about at one of your regular board meetings, or?
I'm sure we will be, either whatever time frame it falls in, we'll talk about whatever meeting. Now that we're switching our schedule up, excuse me, we'll talk about it whenever it's coming up. I'm going to forward what I got for regulations, and we'll probably be talking about it hopefully Tuesday, if everybody can read it by then.
Yeah. So hopefully I have a chance to talk to John and then be able to speak a little more clearly with you Tuesday night.
Okay.
This is Mike. Jim, I'm sorry. I just want to make sure that you and Scott get together on this, because you guys are seriously in a position to write the book on effective measures to protect the public, especially in situations like the camp.
No, absolutely.
That would be fabulous.
Yep. Okay.
Okay, so we're just going to approve some minutes. You don't have to stick around for that, Jim. If you don't want, you can.
Well, thank you for taking care of the CARES Act stuff. And again, if anyone has any questions on that email, certainly give me a call. I'm happy to kind of explain what I know about it and what we're trying to do to stay.
The CARES?
The CARES, yep.
Okay.
Great. Thank you.
Thanks, Jim.
Thanks, Jim.
Okay, so we've got a lot of minutes built up that we need to approve and vote on. So let's start with the first one, May 6th. Does someone want to make a motion for meeting minutes dated May 6th?
This is Mike. I make a motion that we accept the minutes as written for May 6th, 2020.
Is there a second? Lisa, okay. Thank you, Kevin. So we'll do the roll call. Kevin Baker?
Kevin Baker, yes.
Lisa Flanagan?
I can't, I'm in the car on my phone. I can't remember if I read those or not.
Okay.
So I can't make a motion.
Okay. Mike Zeldin?
Mike Zeldin, yes.
Louise Nichols, yes. So we've got 3 votes. The next date is May 12th. So I'm going to make a motion.
I don't know that I read those yet.
Okay, so we'll hold on those.
Okay.
May 13th. Did everybody?
Yeah, I need to catch up on my. I did catch up on my minute reading. I don't know when.
I know that's what I was. That's what I was doing. The same thing this morning.
Yeah.
Okay, so we'll do it Tuesday night if everybody can.
Okay.
Catch up on those minutes. We'll take care of it Tuesday night. Okay.
Okay.
I guess that's it. Does someone want to make a motion to adjourn?
Before we do, Louise, just one quick question, and this has to do with the result of, I guess, would be Monday night. I'm getting the nights lost. Monday night, the joint meeting. According to the minutes, a motion that Kevin made about providing a permit had a condition in it regarding the behavior of the public. I just want to make sure that that's an accurate representation of what we gave the permit on. It's in the minutes. I just want to make sure that people alert to it when you're reviewing them to make sure that that it reflects accurately. I think it does.
So June 1st meeting minutes.
Yeah, at the very bottom. Kevin made a motion that and it was the basis for granting the permit.
Okay.
I'm not trying to relitigate it. I'm just trying to make sure that, because that's going to be our record.
Okay. We just want to be precise.
Yeah, or accurate. Precision is lost already. It's the real world.
Okay.
Okay, thank you.
You're welcome. Can someone make a motion to adjourn?
This is Mike. I make a motion that we adjourn the meeting.
Is there a second? Okay, so we'll take a roll call. Kevin?
Kevin Baker, yes.
Lisa Flanagan?
Lisa Flanagan, yes.
Mike Zeldin,
Mike Zeldin, yes.
and Louise Nichols, yes. Thanks, everybody, and we'll see you Tuesday at June 9th, 7 o'clock p.m., not 2 o'clock. It's going to be confusing.
I can't wait to get back to work so I know what day it is.